So today I'm going to try and talk about sleep. It's a massive, massive subject. So it's going to be very, very difficult to cover everything in one talk. In fact, it will be impossible to talk about everything in one chat. But I'm going to cover what I think is the important parts of sleep for us to know today. So let's just click here. So I'm going to go through the importance of sleep. I'm going to talk about how you would define sleep. I'm going to talk a little bit about the sleep architecture, some basic physiology and the regulation of sleep. And I think that part's quite important because once we understand these parts, we can start to see why we recommend some of the treatments that we recommend at the end of the talk. We're going to look at the health effects of sleep and a brief discussion on how much we need and the common causes that I see as a GP anyway of reduced sleep. Right, so let's begin. So we all know that feeling of having poor sleep, the horrors of trying to function on too little sleep, that lack of ability to concentrate, absolutely smashing down cups of coffees like there's no tomorrow, and desperately trying to get through that day without too much collateral damage. So we all know that immediate mental and cognitive and physical issues that lack of sleep brings. And yet, the long-term implications of sleep is still not yet fully recognized. But we do know that all animals and species that we've studied so far do need to sleep, although the architecture of their sleep may look somewhat different to our own. And with any luck, we'll spend a third of our life in blissful sleep. So if you think about this from an evolutionary perspective, back when we were hunter-gatherers, sleep's pretty dangerous for us, really. When you're asleep, you can't find food, you can't socialize, you can't protect your own community, you can't find a mate. It also increases your vulnerability to predation. So you would have thought there would be a strong evolutionary pressure here, really, to phase sleep out. And so for sleep to survive this evolutionary pressure, you can imagine that the benefits of this must be huge to outweigh its disadvantages. And this chap, who I'm not going to butcher his name, but he was a sleep researcher from University of Chicago, he said that if sleep does not serve an absolute vital function, it is the biggest mistake that evolution has ever made. Okay, so how would we define sleep? Well, descriptively, you might say it's a temporary and reversible state of altered consciousness with perceptual disengagement. Now, that has largely been superseded by EEG criteria, and this is where electrodes are placed on your scalp and your brain waves are recorded through sleep. So this next slide is called a hypnogram of sleep. And the idea of this slide is just to show you that when you're asleep, it's not nothing is happening. It's not this flat landscape of nothing. It's actually this complex landscape of you falling through different layers of sleep. And you can see here that you fall through non-rapid eye movement sleep, 1 and 2, which is the light part of sleep, into 3 and 4. And then you rise up again here into REM sleep. Now, the first 90 minutes of your sleep will largely be dominated by NREM sleep. And then the later parts of your sleep, the rapid eye movement sleep starts to sneak in. And I just want to draw your attention to these two spikes here. And you can see here that you're actually awake at some points during your sleep. And this is entirely normal. We all wake up at some point in our sleep, although we may not fully remember that. Okay. So what are the purposes of those NREM and NREM sleep? Again, this is still being fully elucidated, but we think NREM sleep is important in pruning extraneous circuitry for the memories that we've created that day. The deeper parts of NREM sleep are probably important for regeneration of tissue, bone, muscle, and it also strengthens our immune system. We do dream during NREM sleep, but it has a bit less of a narrative thread than REM sleep. And during REM sleep, this is thought to strengthen that already pruned circuitry. It links our memories to emotions. It improves our memory retention and recall. It's important in fear extinguishing with those memories as well. And we also know that you dream very vividly during REM sleep, but in this case, it has a very strong narrative thread usually. Oops, my mouse pointer gone. There we are. So this is just to give us an idea of the regulation of sleep. And this was taken from one of my favorite books on sleep, which is by Matthew Walker, called Why We Sleep. And it's just to remember that this is actually just a model. It's just a model depicting the regulation of sleep. And it can never fully show you the full complexity of sleep as it happens in real life. But you can see here that we have this process called process C, which is basically our circadian rhythm. And that will carry on through the day, 24 hours a day, and it will wax and wane, and it will be responsive to certain inputs. Now, everyone's circadian rhythm is slightly different, but the average circadian rhythm is roughly about 24 hours and 15 minutes. It's brought into line with the length of the day by our response to light. Essentially, we have a little organ in our brain called the suprachiasmatic nucleus that responds to light. I'll briefly talk about that in the next slide. But essentially, this circadian drive is our wake drive, and you can see that it waxes and wanes, and at about 11 p.m. it's dropping off here in this particular graph. There's another process going on called our homeostatic process, or our sleep drive here. Now, basically, every moment you're awake, you are depleting glycogen from your brain, and you're building up other chemicals like adenosine, which exert a sleep pressure. Now, as that chemical rises up here, you can see that your circadian rhythm starts to fall, and you'll get a very, very strong urge to sleep at this point. And through sleep, you'll start to clear this chemical, and it is only through sleep that you can clear that chemical. So you can see that if you don't get quite enough sleep, you will start the next day at a higher level of this chemical, and that will carry on if you don't get enough sleep to clear it, the so-called sleep debt. Now, whilst we can't clear that chemical apart from through sleep, there are ways that we are trying to change our response to it. And one of the most common ways is drinking loads of coffee. And what caffeine does is it interacts with the receptors that adenosine interacts with in our brain, and fills those in and blocks adenosine's effect, and essentially keeps us awake, stops that urge to go to sleep. But it cannot stop the rise of adenosine in your brain. So that will keep rising and rising and rising no matter what, as long as you're awake. So as soon as you've metabolized that caffeine and it moves away from those receptors, suddenly you'll get a flood of adenosine, and you get an irresistible urge to sleep. And this is the so-called caffeine crash. Okay, so very quickly, one of the regulators of our circadian rhythms is responsive to light, and that enters through our eyes, passes through the optic nerves at the back of our eyes, and deep within our brain, we have something called the suprachiasmatic nucleus that samples the intensity and the wavelength of that light and passes messages on to another gland in our brain called the pineal gland. Now, the pineal gland produces melatonin when it's dark, and that melatonin corrals the rest of our brain into sleep. So you can see that that melatonin is switched off during daylight, as it should be, because we're meant to be awake, but it's also reduced if we have artificial lights at home, if we're watching TVs, backlit iPads, smartphones. All of these things can switch off our melatonin and affect our ability to sleep. There are other regulators of sleep, such as food, fluids, ambient temperatures, and social inputs. But this is one of the main ones, so we're not going to have time really to talk about those other ones, I don't think, in this talk today. So let's move to this. So again, this is just a very quick chat about the sleep physiology. And again, this part is important when we come to talk about sleep hygiene a bit later on. So you can see from this graph that as we're going off to sleep, our brain is producing melatonin, which is initiating our desire to go off to sleep. And as we go off to sleep, you can see that our core temperature needs to drop. And it continues to drop after we've fallen asleep for several hours. Now that will then start to rise later in the night. And as the sunlight comes back through our windows, it hits our eyes through the backs of our closed eyelids and starts to shut off our melatonin. And that will slowly wake us up. Now, there are some important physiological process going on through this sleep period. And there are things like your blood pressure starts to drop, and importantly, your sympathetic drive gets switched off. Now, this is our fight or flight or stress system. And when we don't sleep properly, this system doesn't really shut off at all. So it increases our blood pressure, it increases our stress hormones, it can lead to persistent inflammation and a reduced immune response as well. So you can see how a lack of sleep can give you a biologically plausible mechanism for reduced immune systems and leading on to things like cancers. Also throughout our sleep, we do get things like DNA remodeling and repair and hormonal regulation. And importantly, the hormones leptin and ghrelin, which control our desire to eat, our hunger drive, and our satiety drive, gets disbalanced. So we tend to eat more and we start to search out more calorific foods when we're sleep deprived. And this can carry on into the next day. So you can see as well why sleep deprivation can be linked with things like obesity and diabetes. So moving on, when you understand a little bit about the architecture and physiology of sleep, you can start to understand quite quickly what the benefits of getting a good night's sleep might be. And one of the important ones is that it boosts your memory and it boosts your learning. And it has been shown in some experiments that sleep deprivation can reduce your ability to make new memories by up to 40%. Now, 40% is a huge difference in making memories and learning. Healthy sleep also boosts your IQ. It helps you to think creatively. It helps you concentrate. It also helps you, interestingly, make ethical and moral decisions. And it also improves our physical strength. Other important things are it helps to reduce your risk of heart disease and strokes, diabetes, depression, obesity, and even your cancer risk. And in fact, insomnia is a very reliable indicator for hypertension, obesity, and depression, but also other somatic symptoms like increased muscle tensions, stomach upsets, headaches, and it's also, they're all interlinked with insomnia. And there does seem to be this bidirectional relationship as well with sleep. So for instance, if you are suffering with a mood or an anxiety disorder, or you have pain, that can affect your ability to sleep. And with that poor sleep, it also amplifies the mood troubles and the pain issues as well. And this might be an important mechanism with generalized pain disorders such as fibromyalgia as well. So how much sleep do we need? Well, this varies massively in the population, and it might vary due to your age, due to your life stages, health conditions, and your lifestyle patterns. But if we were to put a number on it, on average, you probably need somewhere between 7 to 9-ish hours per night. And below about 5 to 6 hours, you might start to see some of these detrimental effects that I've talked about, unless you're a short sleeper. However, short sleepers are pretty rare. And an interesting fact is that if you are sleep deprived for 24 hours, people have done studies to see what the equivalent blood alcohol level would be. And they measured it at around 0.1% if you were sleep deprived for 24 hours. And seeing as the blood alcohol limit in the UK is 0.08%, you can see that people that are sleep deprived, such as healthcare professionals after a night shift going home, might be driving in a cognitive state similar to someone that's over the drink drive limit. So how do we define insomnia? What is insomnia? Well, the ICSD-3, which is the International Classification of Sleep Disorders, say that it's the difficulty in initiating or maintaining sleep resulting in impairment of daytime functioning occurring 3 or more days per week for at least 1 month. I think more practically speaking, it's easier to say it's spending more than 30 minutes trying to get off to sleep, or the equivalent amount of time being awake after you have fallen asleep. So you can see that it's it can be a problem with both initiation of sleep and maintenance. So by daytime functioning, what I mean is things like mood disturbances, impaired concentration, daytime fatigue, and some people will report daytime sleepiness, which means falling asleep on your couch or a traffic light in the car, or in dangerous situations if you're driving a car. Now that's actually a red flag sign. So if those kind of things are happening, you do need to seek medical advice fairly quickly, because you may need to be referred on to an appropriate sleep specialist. The primary insomniacs, who are those that tend not to have a secondary medical condition, are those that couldn't take a nap even if they tried during the day, the so-called tired but wired population. So how big is the sleep problem in the UK? So insomnia with daytime consequences probably affects up to 8 to 12% of the population at any one time. And it's estimated that about 30 to 50% will experience insomnia symptoms within their life. The prevalence is definitely rising within the UK, and the age-specific rates seem to show steady rise across our lifespan as well. And women are affected more so than men. Now, this might be due to unique hormonal changes related to the menstrual cycle. It may be due to perimenopausal or menopausal issues at night, or bladder and urinary issues, especially after childbirth. Things like restless leg syndrome are also more common in females, and there may also be some gender reporting differences. So we're nearly finished, but the commonest causes that we see really of reduced sleep is, well, the first one is probably behaviorally induced insufficient sleep syndrome. And that is, in inverted commas, voluntarily not giving yourself enough sleep opportunity. So basically you're sleeping longer at the weekends, you're having to sleep late on a Sunday, so you end up going to bed late on Sunday and then waking up late on Monday morning because you'd gone to bed late Sunday night, and that the cycle continues. And this is associated more with people of younger age, alcohol use, or long working hours, stress and depression. And there seems to be a cultural issue in Western society and in the UK, where sleep seems to be associated with things like weakness or laziness. And the work culture is not really set up for the different chronotypes people have. So everyone is genetically predisposed really to either wake up early, very early in the morning, so-called morning larks, or later in the day, so-called night owls, or somewhere in between. But the work culture seems to only be set up really for, you need to get up early and go to work. The other causes that we do see are primary insomnia. This is insomnia that's not related to another medical condition. And it's usually due to suboptimal sleep hygiene. I'm not going to go into that just at the moment, because I think we're going to talk a little bit more about that in the conversation part. It may be due to partner issues, whether your partner is moving a lot or whether they snore. Do they need to be investigated? Do they need to have a chat with their GP or a sleep specialist? Now, correcting your sleep hygiene is not a panacea. It will not cure all insomnia, even though everyone should be doing it. People with moderate to severe insomnia may need to have other treatments like sleep restriction techniques, and CBT probably has the most evidence behind it for treating this kind of insomnia. And occasionally you might need to use a mixed approach where you're using things like CBT and perhaps medication. Of course, medication is kind of a last resort because it does have other knock-on effects, like it changes the architecture of your sleep and potential addictive properties as well. So we try not to use medications if at all possible. So I'm not going to go fully through this slide, but it's just basically to give you an idea that there are lots of medical conditions that can cause difficulty with sleeping. But if you look closely, you can see that certainly a lot of them seem to be related to that or would respond to lifestyle interventions, things like obstructive sleep apnea and obesity, asthma and COPD, reflux disease, which is much more common in obese patients, diabetes as well, and also mood issues can also respond to lifestyle interventions. Now, a lot of these things might be covered in previous talks in afternoon tea and also in future talks, so I won't go fully into these right now, but I am going to hand you back to our hosts, because I've been talking for ages, and we can have a conversation now, I think.